Thank you for watching the video. This is YouTube Medical University. Numbness, swelling, or pain in your hands could be signs that the blood vessels in your arm are about to become blocked. Our bodies have blood vessels running throughout them. If you connect them all together, it's said they would stretch around the earth 2.5 times. That's how intricately they're spread throughout the body, delivering nutrients to every cell. If you miss the warning signs that your blood vessels are about to become blocked, it can lead to a heart attack if it happens in the heart, or a stroke if it happens in the brain. If the blood vessels in your arm become blocked, that can happen too. We humans became bipedal, using both hands and all kinds of tools, and that's how we've come to live the way we do now. If the blood vessels in your arm become blocked, the tissue can die, a condition called necrosis, which may require part of your arm to be amputated. Even if you avoid that, you might still have lasting effects, like difficulty moving your arm or numbness. Your hands are extremely important if you want to travel, enjoy delicious food, and live an active life in the later years of your life. If a blockage in the blood vessels is found just before it becomes critical, surgery can be performed or a treatment called a stent can be used to widen the blood vessels, and blood thinners can be administered. By using medication, it may be possible to prevent blockages from occurring. In outpatient clinics, arteriosclerosis and diabetes are commonly treated, and from the perspective of a doctor who diagnoses conditions such as myocardial infarction and cerebral infarction, the blood vessels in the arm becoming blocked. I will explain the symptoms, the underlying cause of arteriosclerosis, and dietary methods for prevention. In the second half of the video, I'll share specific diets effective for arteriosclerosis and diabetes, so please watch until the end. At YouTube Medical University, as a practicing physician, I create simple videos to help you get healthier starting tomorrow. Please subscribe so you don't miss new videos. First, let me briefly explain why our blood vessels, which are flexible when we are born, gradually become harder and why arteriosclerosis progresses. If you want to hear about symptoms before your blood vessels get blocked, skip ahead. When blood vessels become blocked, the cause is arteriosclerosis. And as for why arteriosclerosis occurs, the most well-known causes are high blood pressure, diabetes, and dyslipidemia with high cholesterol are the main causes. In addition, smoking is also a factor. For example, if you have high blood pressure, the pressure inside your blood vessels increases. Think about using a hose to let water flow from a faucet. If the water pressure is high, the hose becomes stiff and tight, right? If the water pressure is low, the hose stays flexible. In the same way, when the pressure inside your blood vessels is high, the vessels become tight and stretched due to the increased pressure. And when the pressure is high, it can damage the blood vessels. It is believed that this is where arteriosclerosis begins. Now, what about diabetes? In diabetes, there is a high amount of glucose or sugar in the blood. If granulated sugar is floating around in the blood, it seems like it would damage the walls of the blood vessels, doesn't it? Sugar is just an example, but it is said that when the glucose in the blood increases, each of the endothelial cells that make up the blood vessels gets damaged by reactive oxygen species. And finally, there's dyslipidemia. Dyslipidemia means having high cholesterol, right? The biggest problem with dyslipidemia is having high low-density lipoprotein cholesterol, which is known as bad cholesterol. Bad cholesterol is what carries cholesterol to all the organs in the body. When the blood vessels are damaged, this bad cholesterol gets oxidized, and our bodies recognize it as a foreign substance. The body attacks the cholesterol. The debris left after the cholesterol is attacked is called atheroma. The juku in atheroma refers to something like rice porridge. It's a mushy porridge-like substance. This is called plaque, and it accumulates on the walls of blood vessels. In this way, high blood pressure and diabetes and cholesterol forms plaque on the walls of blood vessels, narrowing them, and then blood can stick there and form blood clots. And eventually the blood vessels can become completely blocked, leading to all kinds of dangerous symptoms in the body. Now then, thank you for waiting. In this first part, I'll explain what kind of symptoms appear when the blood vessels in your arm actually become blocked. Here are 3 signs that appear just before the blood vessels in your arm become blocked. The first one is this. When you move your arm or raise it high, you may experience pain in your arm or notice that your arm turns pale. This is easy to understand if you think about the cause. When the arteries that supply blood to your arm become narrowed due to progressing arteriosclerosis, the blood vessels gradually become thinner. As a result, the narrowed blood vessels can't provide enough blood flow or nutrients. When you move your arm vigorously, it needs a lot of nutrients and oxygen, but due to arteriosclerosis, they can't be delivered properly. At such times, you may experience symptoms like pain or numbness in your arm. Now, I'd like to introduce a simple test to help you determine whether the blood vessels in your hand are clogged. It's called the Allen test. Our hands are supplied by the radial artery and the ulnar artery. These two major arteries form a loop that supplies blood to the hand, so even if you press on one of the arteries, blood flow to the hand is usually maintained. However, if one of the arteries is already blocked, pressing on the unblocked artery will stop blood flow from both sides, causing the hand to turn completely pale. Now let's try it. When blood flow is maintained like this, the color of the hand stays reddish. Now I'll press on both arteries at these 2 points. By pressing firmly and repeatedly opening and closing the hand, the blood flow gradually stops and the hand turns pale. Now I'll release one finger. As you can see, the redness returns to the palm. If it takes more than 10 seconds for the color to return, the blood vessel on the side you released may be blocked. Since I'm a doctor, I use my own fingers to press, but ideally you should have someone else use 3 fingers to press both sides of the blood vessels. Then please check if the blood flow returns when you release one hand and also when you release the other hand. Please let me know how it went for you in the comments section. And if arteriosclerosis progresses in the blood vessels of the arm like this, or if a blood clot travels to the artery in the artery can suddenly become blocked. This is called acute arterial occlusion. In fact, the most common reason for an artery in the arm to become blocked is this acute arterial occlusion. There is a possibility that arteries throughout the body can become blocked by things like blood clots, but it is said that the probability of the blood vessels in the arm becoming blocked is about 15%. What symptoms would occur if your arm's blood vessels were suddenly blocked? After watching this video, if you or someone you know experiences these symptoms, you should consider going to the hospital right away, even at night. Severe pain in the arm, no detectable pulse in the arm, the hand turns completely pale, numbness in the hand and difficulty moving the hand. If these symptoms appear suddenly, there is a possibility that the blood vessels in your arm are blocked. And for arterial blockage in the arm, the so-called golden time is said to be 6 to 8 hours. What is the golden time? It refers to the period within 6 to 8 hours after the blockage occurs, during which treatment to remove the blockage is likely to restore full function without any lasting after effects. On the other hand, if you miss this golden time, even if treatment is possible, there is a high chance that after effects will remain, such as difficulty moving the arm or numbness. Those kinds of symptoms may persist. I hope you will be careful. Earlier I mentioned blood clots getting stuck, but ideally we want to prevent blood clots from forming before we even need to detect them early. So what is the most common cause of sudden blockage in the blood vessels of the arm? That would be an irregular heartbeat or arrhythmia. Have you heard of the term atrial fibrillation? Our heart acts as a pump to circulate blood throughout the body. When you have an arrhythmia, the heart can't contract regularly, so blood pools inside the heart and can form clots. This is known as a blood clot. If it forms in the heart, it can be pumped out and move through the body. If a blood vessel in the arm gets blocked at that time, it leads to acute arterial occlusion of the arm. That's why it's very important to detect this arrhythmia called atrial fibrillation early. Many people with atrial fibrillation have no symptoms, but if there are symptoms, they may feel palpitations or feel like their pulse is skipping. You may feel unwell or short of breath even with slight movement. These are also possible symptoms. If you experience such symptoms, please try checking your pulse. The radial artery is the blood vessel located below the thumb. Use your index, middle, and ring fingers to check if you can feel your pulse there. If your pulse feels like thump, 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 thump and is not regular, there is a possibility of atrial fibrillation, so please consult a nearby cardiologist. At hospitals, medical fees are generated by diagnosing and treating illnesses. However, what's really important is to prevent getting sick in the first place. I believe that what's important is the stage before getting sick, preventing future illnesses. At YouTube Medical University, we create videos to solve those kinds of issues. If you feel like supporting us, we'd be happy if you subscribe to our channel. Here are 3 signs your arm's blood vessels may soon be blocked. The second is swelling or puffiness in your arm. Everyone, have you ever heard of economy class syndrome? When you sit in the economy class of an airplane for a long time, the seats are cramped and you can't move your legs. The blood flow in your legs slows down and blood clots can form. If a clot that forms in your leg travels to your lungs, it can suddenly make it hard to breathe and become a life-threatening condition. Sometimes these blood clots can also form in the veins of your arms. This condition is called Paget-Schroeder syndrome, named after the people who discovered it. You don't need to remember the name. Blood flows from the arteries in your arm into the veins and returns to the heart, but if these veins become blocked, blood flow slows down. This can cause your arm to swell up, hurt when you move it, and develop cyanosis, where your arm turns a reddish purple or bluish color. This condition happens to about 1 in 10,000 people. It's not a common disease by any means, but if you miss it, it can be very dangerous. It's said to be more common among athletes who use their arms a lot and people who do physically demanding work. If these symptoms appear suddenly in one arm, in that case, we consider this disease. In actual examinations, we use ultrasound to check for blood clots in the blood vessels, or use contrast agents for computed tomography scans to look inside the blood vessels of the arm to make a diagnosis. If detected early, it is said that using blood-thinning medications and similar treatments can often gradually dissolve these blood clots. However, of course, if detection is delayed, symptoms can worsen and the blood clot may travel to other organs and cause complications. Since this hasn't been explained much on other YouTube channels, I hope you'll be careful. Here is the third sign that your arm veins are about to become blocked: peripheral neuropathy caused by diabetes. If you're wondering what the connection is between the blood vessels and nerves in your arm, that's a sharp observation. However, when the small blood vessels in the arm, especially in the hand, become blocked or impaired, it can actually cause symptoms of nerve damage. When you have diabetes, the damage starts with the small blood vessels. So without even noticing, these tiny vessels gradually begin to get blocked, and before you know it, you might start experiencing numbness in your hands, like there's a thin layer of skin covering them. Rather than being a symptom that appears right before a blockage, it's more of a symptom that develops gradually as the vessels slowly become blocked, so it's important to detect it as early as possible. Peripheral describes body parts farthest from the center. When the nerves in your fingertips or toes are affected, you may experience numbness or a loss of sensation, as if there's a thin layer of skin covering them, or as if you're always wearing gloves. You may feel sensations like that, or experience a burning pain. Those kinds of symptoms are common. In fact, diabetic neuropathy is one of the 3 major complications of diabetes, and about half of people with diabetes experience it, making it one of the most common symptoms. But why do you only feel numbness in your fingertips and toes? It's easier to remember if you think about the reason. When you have diabetes, arteriosclerosis progresses. Why does this happen? When the sugar in your blood attaches to proteins, it creates a substance called advanced glycation end products, or advanced glycation end products. It's said that this damages the walls of your blood vessels, which leads to the progression of arteriosclerosis. And actually, running parallel to these arteries are the nerves. Arteriosclerosis caused by diabetes affects the small blood vessels first. In other words, along with the small blood vessels, the nerves are also affected. That's why the fingertips and toes, where the small blood vessels run, and the nerves that run alongside those vessels, are gradually damaged starting from the nerves. In addition, having high blood sugar itself is thought to cause inflammation of the nerve cells, and that inflammation itself can be a cause of numbness. It's interesting when you think about the reasons behind it, isn't it? By the way, the 3 major complications of diabetes, besides nerve damage, are kidney damage and eye damage. We remember these by taking the first letters and calling them shimeji in medical school. Now that you know the reasons, it's easier for you to understand why these complications occur. These are organs with fine blood vessels running through them. The kidneys, in a way, are a collection of blood vessels. Tiny blood vessels are spread throughout, and from there, filtration occurs. The fluid becomes urine, and the urine is excreted from the body, so the kidneys are filled with fine blood vessels. And right now you're using your eyes to watch this video, but the blood vessels in your eyes are also very intricate and finely spread throughout. So, when these fine blood vessels are damaged, it can lead to problems with your nerves, eyes and kidneys. I hope you'll remember this. Taking care of your eyes is also important if you want to stay active and enjoy things like exercise and good food throughout your later years. That's why I always tell my patients with diabetes to visit an ophthalmologist at least once a year to have their eyes checked. So, getting back to the topic of nerve damage and numbness in the hands, what can we do to slow the progression of these nerve disorders? To slow down their progression, the important thing is to properly control your blood sugar after being diagnosed with diabetes. There is an indicator called hemoglobin A1C that shows the average trend of your blood sugar levels. If you aim for a value of 7% or lower, you can reduce the risk of numbness, eye symptoms, and kidney disorders. That's what is generally said, so I hope you can use it as a guideline. Also, this hasn't really been mentioned in other videos. However, there is something called the legacy effect, and after being diagnosed with diabetes, the first 10 years, how well you can stably control your blood sugar early on is extremely important to prevent future complications. For these reasons, which I'll discuss in the second period, it's really important to catch the early symptoms of diabetes as soon as possible and properly control your blood sugar. The most well-known hand symptom caused by diabetes is this peripheral neuropathy, but conversely, this is the only one that is widely recognized. If this numbness progresses, all we can really do is symptomatic treatment, like using medication to suppress the numbness. Many people are told by those around them or by medical professionals that there's nothing that can be done if diabetic hand numbness has progressed, so they end up giving up. However, if you can stabilize your blood sugar levels, this diabetes-related peripheral neuropathy can be prevented from progressing. Therefore, in the following, I will introduce ways to prevent arteriosclerosis. I hope you will try dietary methods to lower your blood sugar and stabilize your diabetes so that your symptoms do not worsen. Now, let's review the first lesson. As signs that the blood vessels in your arm are about to become blocked, first, I explained arteriosclerosis of the arm, symptoms such as pain or numbness when moving the arm, and also acute arterial occlusion, where a blood clot suddenly blocks the vessel. Second, although it is a rare disease, I explained about Paget-Schroeder syndrome, where the vein in the arm becomes blocked, which is like the arm version of economy class syndrome. I introduced a disease where your hand swells, changes to a bluish color, or hurts when you move it. And third, due to diabetes, as a sign that the small blood vessels in your arm are becoming blocked, I introduced peripheral neuropathy and numbness in the arm. Now, thank you for waiting. In the second part, I will introduce 3 dietary methods to prevent arteriosclerosis. Here is the first of the 3 dietary methods to prevent arteriosclerosis. It is to practice vegetarian first. Many of you who are health conscious may have heard of the term veg first. I actually do it myself as well. Veg first means that when you eat a meal, you start by eating vegetables first. By doing this, you can prevent a rapid spike in your blood sugar levels. This is known as a blood sugar spike, and data shows it can be managed. That's only natural because dietary fiber isn't digested and reaches the intestines. That's why your blood sugar doesn't rise. So first you fill your stomach with vegetables, and then you eat quickly absorbed foods like carbohydrates. That makes it easy to understand how the rise in blood sugar becomes more gradual, doesn't it? In fact, in a study conducted on Japanese people, there was a group that ate their meals normally and a group that practiced veg first. The increase in blood sugar was more gradual in the veg first group. And what you need to be careful about is not just practicing veg first, but also chewing each bite about 20 times. In other words, taking your time to eat. This study involved eating foods with a low glycemic index value, foods that don't easily raise blood sugar, so along with veg first, the time spent eating, and let's also remember about the glycemic index value. I'll talk about glycemic index values in the latter part of the video during the 4th section about fruits. Up to this point, I think many of you have heard this before. However, recent research has shown that along with veggie first and vegetables, there is actually something else you should eat first. That is protein. This is also from a Japanese study. They compared a group that ate white rice first with a group that ate either canned mackerel or beef first instead of white rice. As a result, the group that ate mackerel or beef first had a more gradual increase in blood sugar compared to the group that ate white rice first. Based on these results, I advise people to make a conscious effort to eat protein along with vegetables first. Call it veggie protein first. It's easy to remember. Give it a try. Protein is usually in the side dishes, so start eating from those. If you thought, does that mean I have to eat just plain rice at the end? I feel the same way. So specifically, you can add shredded salad chicken or put some cheese on your salad. If you make a salad with vegetables and tofu and try to eat vegetables and protein together, the volume of vegetables increases, it takes longer to eat, and it becomes veggie protein first. I recommend eating this way. Please give it a try. Here is the second of the 3 dietary methods to prevent arteriosclerosis. Eat 3 proper meals a day. Make sure to eat 3 meals. If you think that's just common sense, I wouldn't mention it if it were obvious. According to a study, they gathered 22 patients with type 2 diabetes and had them eat 3 meals a day and then 2 meals a day. They skipped breakfast and only ate lunch and dinner and examined how their blood sugar levels increased. Even though the calories per meal were the same, when they skipped breakfast, their blood sugar levels after lunch and dinner were higher than usual. In other words, skipping breakfast leads to surprising results. Even if you eat the same food later, the way your blood sugar rises changes. Let me explain this in simple medical terms. When we eat rice, it gets broken down into a type of sugar called glucose. When this glucose is absorbed into the bloodstream, it becomes what we call blood sugar. If this blood sugar level is high, it can lead to diabetes. How can we lower this blood sugar level? It's lowered by a hormone called insulin. Insulin is a hormone that comes from the pancreas. Insulin doesn't actually break down the glucose. Insulin's role is to move glucose from the bloodstream into the cells that need nutrients. Please try to think from the perspective of the pancreas and the cells. When breakfast doesn't come, the body is in a state of starvation. So when lunch finally arrives, the body tries hard to eat and absorb food all at once to raise blood sugar levels. Because of that, blood sugar levels rise rapidly, which surprises the pancreas. Since blood sugar suddenly goes up, the pancreas releases a lot of insulin. Believing it must lower blood sugar, the pancreas releases a surge of insulin, rapidly dropping blood sugar levels. As a result, just like in this illustration, blood sugar levels rise sharply and then drop rapidly, creating what's called a blood sugar spike. It's easier to understand and remember if you consider the reason behind it. Blood sugar spikes are said to cause arteriosclerosis. So, skipping meals and then suddenly overeating makes your blood sugar more likely to spike. Even on busy mornings, please try eating the foods and fruits I'll introduce next. Here is the third dietary method to prevent arteriosclerosis. It's about eating a balanced diet. Some may think, isn't 3 balanced meals a day obvious? But even so, it's actually pretty hard to do. So just how good is eating a balanced diet for your health? If you understand the reasons behind it, you'll see how important it is, and I think you'll want to incorporate it into your daily life. There's a study from Japan about this. When people eat meals, they looked at what happens when you eat an unbalanced meal, like eating only carbohydrates, or eating carbohydrates and protein together, or when you eat carbohydrates and fats together. A study examined if blood sugar rises differently with these 3 patterns. I think you can guess the results. Only the group that ate just carbohydrates had a rapid spike in blood sugar after eating. For the other groups that ate carbohydrates together with protein or fat, the rise in blood sugar was much more gradual. What do you think about that? So, it's actually important for your blood sugar not just to do a veggie fast, but also to eat protein and fat together. Earlier, I mentioned the veggie protein fast, right? In other words, it's important to eat vegetables, protein, and fat together, not just carbohydrates. Nutritionists and health programs on television often say, eat a balanced diet or eat 3 meals a day, and it's because of data like this. Isn't it interesting when you understand the reason behind it? Let's review the first lesson. I introduced 3 dietary methods to prevent arteriosclerosis, starting with the vegetan fast instead of just veggie fast. Second, I talked about not skipping breakfast and making sure to eat 3 meals a day, and also not just eating carbohydrates. I also mentioned that eating protein and fats with your meals helps prevent blood sugar spikes. There's also fasting, where you eat just 1 meal a day. Some of you might be wondering if things like petit fasting, which became popular, are actually good for your health. Now in the third period, I'll introduce 8 eating habits that help prevent spikes in blood sugar. This time I selected foods based on their impact on blood sugar, affordability, and ease of adding to meals. Please use this as a reference. I'll be introducing 8 items this time, and half of them, 4, are sources of protein. I'll also recommend 2 types of vegetables, 1 carbohydrate, and finally I'll introduce a fruit. 8 dietary tips to prevent a rapid spike in blood sugar. The first one is this, natto. When you think of Japanese people, you think of natto. This natto is actually a superfood. When I eat lunch, I have natto almost every day. This natto contains something called pectin. It contains nutrients that are believed to help suppress the rise in blood sugar levels. Also, natto is a source of protein, right? The protein in these soybeans is said to have a good balance of amino acids. And that's not all. Natto is also rich in vitamins and minerals. There's even a substance called nattokinase that is believed to help thin the blood. As I mentioned in the first class, it's very important to consume protein along with carbohydrates. Prices are rising, but sometimes you can still find a pack of 3 natto for less than 100 yen. Why not try eating 1 pack a day? 8 ways to control sudden spikes in blood sugar. Here's the second one, chicken. We've emphasized this many times before at YouTube Medical University. We've explained that you should eat chicken rather than red meat. What's the difference between red meat and white meat? Actually, red meat, meaning beef and pork, especially processed products. Processed foods like ham, hamburgers and sausages are said to increase the risk of colon cancer. Of course, it's not that eating them at all is a risk, but eating a certain amount is said to increase the risk of colon cancer, so please be careful. On the other hand, chicken is not associated with these risks, and among meats, it is said to have less fat and more protein. Chicken breast and tenderloin are especially recommended. When these are on sale at the supermarket, you can get them for less than 100 yen per 100 grams. You can mix them into salads or make minced chicken. You can also mix them into stir-fried side dishes, so there are many ways to cook them. Protein is a nutrient that tends to be expensive or lacking, so please try to include it consciously in your diet. To learn more about red meat and colon cancer, watch the video linked in the description. Here are 8 eating habits to prevent rapid blood sugar spikes. Here's the third one. Eggs have also become much more expensive, but I included them because they're still easy to incorporate into your daily meals. Eggs are often called a complete food, aren't they? Eggs contain carbohydrates, protein, fat, and many vitamins. It's said that just by eating one, you can get a well-balanced intake of nutrients. One thing to be careful about is that eggs don't contain dietary fiber, so you'll need to get that from other sources. Earlier, I mentioned that it's better to have carbohydrates and protein together, right? For example, having a fried egg with rice, rice with raw egg, or adding a boiled egg to your salad are all good combinations. This shows eggs can be used in many ways. You can use them in cooking in many ways. To make sure you include them, you could set a rule for yourself to eat at least 1 egg a day. Expanding your egg dish options may help keep your blood sugar from rising too much. My recommendation, which I used to do a lot when I was busy in college, is to boil about 10 eggs at once in a pot and keep them in the refrigerator. Just be careful with the amount of salt you use. But I also recommend keeping them as seasoned eggs. Boiled eggs are great for busy mornings, as a snack when you're a little hungry, or even as an extra dish for dinner. Please try making and storing them smartly. Here is the 4th way to eat to prevent a rapid rise in blood sugar. Canned mackerel. I've introduced canned mackerel many times before. The mackerel contains the oil is actually good for your body. Oils are divided into saturated fatty acids and unsaturated fatty acids. Most saturated fatty acids are found in salad oil and butter, and also in the fat found in red meat. Unsaturated fatty acids are the light oils found in fish, as well as in olive oil and flaxseed oil. Saturated fatty acids tend to raise cholesterol and triglyceride levels, while unsaturated fatty acids, on the other hand, are expected to help stabilize or lower cholesterol. And mackerel is considered a superfood. It is rich in unsaturated fatty acids called docosahexaenoic acid and icosapentaenoic acid, and the more fish you eat, the more it helps prevent the blood vessels in your heart and brain from getting clogged. There is data showing that it lowers the risk of arteriosclerosis. It's said that eating just 100 grams a week can be effective. In other words, by eating canned mackerel, you not only get protein and slow down the rise in blood sugar, but icosapentaenoic acid and docosahexaenoic acid also work to lower the risk of your heart and brain blood vessels getting clogged. Canned mackerel in water can be stored a long time. Even on busy days, it's easy to include in your meals, and since mackerel has a concentrated umami flavor, it actually tastes great even when mixed with things like pasta. If you think this sounds good, pause this video and buy some canned mackerel. Here's the 5th tip for eating habits that help prevent rapid blood sugar spikes. Among vegetables, it's broccoli. Everyone. Broccoli was actually recently designated as a specified vegetable by the government. Broccoli became a specified vegetable for the first time in half a century since potatoes. But putting that story aside, why is that? Why did I introduce broccoli? Well, actually, broccoli is a vegetable that's high in protein compared to other vegetables. For example, regular vegetables like cabbage have 1.2 grams of protein per 100 grams. Carrots have 0.7 grams, and green peppers also have 0.7 grams. In contrast, broccoli contains 5.0 g of protein. By the way, even rice, which is a carbohydrate, only contains 2.5 g. In other words, by eating broccoli, you can effectively get protein as well. After all, protein is expensive and hard to get, so it's important to get as much protein as possible from a variety of foods. Although I haven't mentioned it in this video, consuming an amount of protein in grams equal to your body weight can help prevent frailty, which is when your body and legs become weak, your muscle strength decreases, and you become more likely to fall or need nursing care. It reduces the risk of those causes. That's why I recommend a lot of protein, and when it comes to getting protein from vegetables, broccoli is the go-to. But that's not all. Broccoli is actually it's a vegetable with a well-balanced nutritional profile. It contains a concentrated amount of all kinds of nutrients like vitamin B, vitamin C, vitamin E, vitamin K, as well as iron and potassium. Recently, frozen broccoli has been sold at convenience stores and wholesale supermarkets. When you don't have much time to boil vegetables, it's a good idea to buy frozen broccoli and use it in your lunchbox or as a side dish for breakfast. I recommend making use of these kinds of ideas. I actually do this myself. Here is the 6th method for controlling rapid spikes in blood sugar: wakame seaweed. When you think of wakame, you probably think of dried wakame. Even a small amount will expand a lot when you soak it in water. Wakame may look like it doesn't have any nutrients, but it's actually very nutritious. That's what we call soluble dietary fiber. There are 2 types of dietary fiber, soluble and insoluble. Both are important, but insoluble fiber, as the name suggests, doesn't dissolve. It passes through your system and helps improve bowel movements. And soluble dietary fiber dissolves in water, softens your stool, and also serves as nutrition for your intestines, helping to balance your gut bacteria. But that's not all. In fact, there are reports that it may help slow the rise in blood sugar levels. Soluble dietary fiber is actually quite hard to get enough of. That's why I recommend wakame, which is easy to eat. Foods that contain soluble dietary fiber tend to have a slightly slimy or sticky texture, like wakame or okra, and also natto, which I mentioned earlier. So please try to include these in your diet. I also recommend mixing natto and okra together and eating them. 8 dietary tips to avoid rapid blood sugar spikes. The 7th is barley rice. Many assume carbohydrates easily raise blood sugar, right? That image is correct. You need to be careful with carbohydrates. Rice, noodles, bread, they're all delicious, aren't they? But if you eat too much of them, your blood sugar will go up. Among carbohydrates, you especially need to watch out for white carbohydrates. Things like white rice, bread, and white noodles, such as udon or sumin. These carbohydrates are refined. For example, in the case of rice, the bran is removed, leaving only the pure carbohydrate, which is what makes it a white carbohydrate. In other words, because it's pure, it tends to raise your blood sugar levels easily. Based on what I've just explained, brownish carbohydrates are recommended if you want to avoid a rapid spike in your blood sugar levels. That's why I introduced barley instead of white rice. Also, instead of regular bread, you can use whole wheat bread. For noodles, it's said that those containing bran, like soba noodles, are less likely to cause a spike in blood sugar. Everyone, have you ever tried barley? I usually eat rice with a bit of barley mixed in. Barley is actually chewy, and it has a slightly popping texture and is actually quite delicious. If you use only barley, it can be hard to eat, but if you mix it with white rice at a good ratio, about 2 to 1, it becomes really delicious. Some of you might be thinking, isn't brown rice the healthy rice? Of course, brown rice is great, but barley is even better. Per 100 grams of rice, brown rice contains only 3 grams of dietary fiber, but barley actually contains about 1-3 grams. It's clearly a lot more, right? And to add to that, barley has a high proportion of soluble dietary fiber, which I mentioned earlier as being less likely to raise blood sugar levels. In other words, it has a lot of dietary fiber, helps keep blood sugar levels stable, and thanks to the soluble fiber, it can also improve bowel movements. It can further reduce blood sugar spikes. Try adding it to your diet tomorrow. This is the 8th way to control rapid blood sugar increases. It's fruit. Some people might think, if you have diabetes, aren't you not supposed to eat fruit? I think a lot of people feel that way, but in reality, that's not how I advise my patients. What's important is the total calories. It's true that fruit contains a lot of sugar, so the calories can add up quickly. However, if you eat the right amount, fruit is a food that is rich in fiber, vitamins, and minerals. That's why I think it's perfectly fine to include fruit in your diet. In the 4th period, I'll share recommended ways to eat fruit. Let's review what we covered in the 3rd period, managing blood sugar spikes. We talked about 8 recommended foods: natto, chicken breast, eggs, canned mackerel, broccoli, wakame seaweed, barley, and fruit. How was it? This time we talked about the symptoms that occur right before the blood vessels in your arm become clogged. And I also explained dietary methods to help prevent arteriosclerosis and diabetes, which can cause these symptoms. It was a long video, but thank you so much for watching until the end. Now that we live in an information society, all kinds of information are available. While there is a lot of useful information, there is also some incorrect information out there. I believe it's very important to have at least one reliable source of information, so if you found this helpful, subscribing to the channel would encourage me. And related to this video, in our long lives, we all want to be able to walk on our own feet, right? But sometimes the blood vessels in our legs can get clogged. I'm also sharing videos about the warning signs that appear just before such dangerous situations. And in other videos, I explain the signs that show up right before important organs like the heart or brain get clogged.